Hello students and faculty, I'm Bob Wilfert, one of your FRAMES course coordinators, here to get you ready for practicing a comprehensive physical examination. In previous weeks, students have practiced with the help of small group faculty instructors how to do a head and neck examination, lung and heart auscultation, and evaluation of the abdomen. In the next few weeks, we'll be asking them to practice those techniques in a rationally sequenced format, one that feels like it's got good flow, so that by the end of the autumn, they feel able to perform the core elements of a physical examination. Attached to the email link, or seen in Blackboard, will be a list of elements that we think should be included in a core physical examination for any comer. Students are encouraged to use this list of examination elements as they practice in preparation for those small groups. And faculty members will be asked to use that form to help guide the students as they practice under observation. Of course, in a general checkup for a person who doesn't have an acute complaint, we're not performing every part of a physical examination or every examination element that we've ever learned. Instead, we're choosing the elements of a physical examination that are derived from the hypotheses we've gathered heading into that portion of our interaction. Because in a physical examination for a person who doesn't have a chief complaint and is just looking for a general checkup, the basic hypothesis is that there's probably not going to be a lot to find, and so the elements of the core physical examination are somewhat limited. The elements that are included on the to-do list were derived from two major sources, one being the United States Preventive Services Task Force recommendations on what should be included in universal screening for an adult, and two, a survey of internal medicine clerkship directors and teachers of physical examination courses across the country. It's important to note that additional elements of physical examination, i.e. special tests, might be included for any real human that you come into contact with, but those aren't part of this assessment, which is mostly meant to generate a sense of comfort and competence that a person can contribute to an outpatient interaction. Faculty members, please remember that our goal here is a sense of confidence in sort of basic mechanics. We're not looking for expertise, especially in the first of the 3 scheduled practice sessions. At any point during the student's half hour or so under your direct observation, if you feel a need to interrupt, coach, reposition, please do so. This isn't meant to be a stressful thing. No judgment is administered towards students if they need an extra helping hand. Now, as they move through the second practice session and through to the third practice session, the amount of coaching I expect would be reduced, such that on the 4th visit of the comprehensive physical examination, they can do it without much guidance and as more of a summative assessment. Students and faculty members, I have a couple special requests of you. First of all, not washing your hands or using hand hygiene prior to contact with the patient's a deal breaker. And if you forget, head on back and grease up. And faculty members, if you see a student progress to physical examination before hand hygiene, wave them off, please, and restart. And secondly, it's a personal pet peeve when I see physicians, clinicians trying to auscult through cloth. Can't do that. We need to expose. We need the stethoscopes on skin. So please make sure that you're using best practice as you practice. What fun it is that by autumn of your first year, you're going to be able to contribute in a meaningful way to the care of our outpatients as you move into the FRAMES clinic. Thanks for doing this.